A new drive-through coronavirus testing site is up and running in the metro Atlanta area. It is one of several drive-through sites the county health officials are running across Georgia. NBC News correspondent Blaine Alexander's in Marietta, Georgia, and joins us now. Blaine, from what we understand, the facility where you are only tests patients who have been first referred by a doctor or a healthcare provider. Could you talk us through that process?
Yeah, so they have to be specifically referred by a doctor, Allison, but that doctor has to actually enter their information into a database that was created by the state health department. It then spits back a number to give to the patient. They have to bring that here, and then, and only then, can they actually be swabbed for coronavirus testing. So yeah, it's a process that has a lot of steps. It's a very detailed process, and in the end, very few people are actually going to be tested, and that's because they just don't have the supplies, Allison. So consider this. This facility right here behind me serves about 900,000 people. We're talking about two counties, Cobb County and Douglas County, right outside of metro Atlanta. So 900,000 people. When I spoke with the county health director earlier today, though, I asked her exactly how many tests do they actually have in supply. She told me that for all of the people they're trying to serve, they've got fewer than 50 tests.
Oh,
That's
goodness.
50 tests.
Wow.
So that just lets you know that there are going to be far more people who are not able to get tests than the precious few that are. Now, she says, of course, they're hoping to get more tests over the next few days, and they can kind of ramp up testing as supplies come in. But as of right now, we're talking an extremely low percentage. So what they're doing is they're prioritizing people who are at the highest risk of actually spreading this to others. So we're talking about healthcare workers, we're talking about law enforcement officers, those who are needed to respond to this crisis in real time. Some people who may be working at nursing homes or working with the elderly population. Those are the people that they're prioritizing. But considering with fewer than 50 tests, even all of those people are not going to be fully tested, Allison.
Yeah, I was going to ask you, Blaine, I mean, with just 50 tests, how sustainable is this great idea to have this process, but it doesn't seem like they can keep this going for all that long?
Not very long. You're right. Absolutely. So bottom line, they're hoping that more tests are going to come. And in fact, I actually asked them today when we spoke with them a few hours ago, how exactly do you stop people from hearing that there's testing? There are plenty of people out there who may be symptomatic, who may go to their doctors and say, I want a coronavirus test, hear that there are testing facilities and come up here. And it's very likely that they will get turned away. In fact, we were actually out here since earlier this morning, and we saw people get turned away. They've been lined up since 8 o'clock this morning. Some of them, they were told to go back home, sent away because they just don't have the supplies to test them. So I asked her about this, and here's her message to those people. Take a look.
We have to protect our hospitals right now, and we have to protect our people that are taking care of our population. So this is why we're doing this the way we're doing it right now. It's limited tests, and as we get more, we will do more people. But, you know, that's why I need everybody to know that if you have mild symptoms, you need to stay at home.
So you heard her right there. If you have mild symptoms, you need to stay at home. It's very likely that you will not get tests. But Allison, I've got to say that it really is an emotional ordeal for so many people. Some of the people that we spoke to this morning, there was one woman who actually kind of came up closer to us and asked, hey, can you put us on TV? And that's always a strange, or put me on TV. That's always a strange, kind of request to get. But as she talked to our producer, Charlie Giles, she was literally standing there with tears in her eyes. And she said, my doctor told me that I probably should get tested. She talked about her symptoms. She said that she'd been feeling bad. She said that she was just scared and wanted to know what was going on with her. So that's just one person who's come up here again without that referral number. So she was turned away. But just an example of the scarce amount of tests and the many people who are trying to get them, Allison.
It's really a scary situation. Blaine Alexander in Georgia, thank you so much for updating us. The next deadly coronavirus cluster may not be on a cruise ship or in a city. It could be in jail. Some experts are warning that prisons are not ready for the pandemic, so some lawyers are trying to get their clients out on early release. NBC News legal analyst Danny Savalos joins me now. He is one of those lawyers. Danny, that is the most professional-looking Skype we've had all day, definitely coming from a lawyer. Tell us about the motion that you filed yesterday.
So, like many criminal defense attorneys, we are moving to try and get clients out of custody, especially pretrial detainees, low-risk individuals, first-time offenders, people not charged with guns, drugs, or similar type offenses. Those are the ones most likely to be able to get out on what's called temporary relief pending trial. Now, I'm sure there are going to be motions to try and get prisoners serving prison sentences, and I know there's more higher risk prisoners with health issues that defense attorneys are trying to get out. And those may face a more steep uphill climb. And, really, judges in court really have a dilemma in front of them. I sympathize with them because, on the one hand, they need to keep society safe. And on the other hand, they also need to keep society safe. So you have these competing interests involving public health and safety slamming headlong into each other.
So, Danny, let me ask you this. I mean, as we see more cases like this come up, what do you think it would actually take for a judge to release an inmate from prison? Are there certain criteria where you say, all right, this may be the thing that would get somebody out?
We already have mechanisms in both federal and state criminal justice systems to get inmates and detainees, people awaiting trial in jail usually, to get them out if they have a serious illness or even if they are close to death or going to be dying soon. So we have those mechanisms in place. The challenge for court is going to be when you have a pandemic that potentially affects everyone. You can't open up all the jails like Iran reportedly did, letting out 54,000 inmates. That is probably not feasible in our criminal justice system. But on the other hand, there are individuals who should be let out. Again, low risk, nonviolent offenders, no firearms type offenses. Those are the kinds of things I can see judges drawing a line. But then again, there's an argument to be made that even if you have an offender who maybe is charged with a firearms offense, but he has a health condition that puts him at high risk, maybe that offender, if conditions can be prepared. And I'm talking about adequate house arrest, monitoring, electronic monitoring, GPS, ankle bracelets, those kinds of things that can assure the safety of the community, but also assure, or you can't assure a safety during a time of coronavirus, but that will help at least assuage the concerns of the court somewhat during this pandemic time.
Danny, let me ask you, you mentioned safety and security. Yesterday, we reported that an employee at Sing Sing, for folks who don't know, that's a correctional facility in Westchester County, New York. Someone there tested positive for coronavirus, an employee there. Experts are warning, as we've been saying, U.S. jails are just not ready for this pandemic. There is really not a lot of social distancing there. If you're not able to get clients of yours out, is there anything you're advising them to do or anything that they can do to just protect themselves in jail?
There's not much to advise a client to do because one of the essence of being incarcerated is that you have no control over your own life.
Right.
It's more that we are pushing jails and prisons to change their procedures and respond appropriately to the crisis. And again, just as you pointed out, jails and courthouses alike are a pandemic's worst nightmare, or maybe a pandemic's favorite thing ever, because by their very design, you have lots of strangers herded into one room where they sit around and wait all day, whether it be a courthouse or a courtroom or a jail cell. They're just, by their very nature, a breeding ground for illness and any kind of communicable disease. That's the way they're designed. So again, courts have a challenge in front of them. They have to incarcerate people, but at the same time, they have to keep people safe to the extent they can from this pandemic. And so what I expect you might see is judges making calls with more low-risk type offenders, people who are incarcerated, waiting trial, who are presumed innocent, who don't pose a threat to society. A good example might be people who are held on immigration detainers. That might be, there is a push I know of through some of the criminal defense bar to try and get people who are just detained on immigration detainers out. And so you may see judges making those kinds of decisions, but it's important to remember that the federal and state courthouses operate like fiefdoms in many ways. What you're going to see is a patchwork quilt of remedies applied by different judges and justices across the country.